Hi, Sylvain from Monkey's Osteopathy. Today, I'm going to present osteopathy for athletes. Big thanks for the people who came today for the first webinar. And I'm going to try to explain a little bit about what we do and give some tips to understand how an athlete could be in better health and avoid injury and maybe heal faster at the same time. I know that osteopathy is not very known in the area, and it's why I think it's always good to learn new things to try to help you and to be in better health and avoiding injury. To do a rapid history of osteopathy, it's come from American physician Andrew Taylor Still, and he was trying to understand how he can help people to heal by themselves without medication or surgery. And it was in 1885. And I don't think surgery at this time was the same than nowadays. And the principle of osteopathy is the body is working like a whole, and any perturbation will change the dynamic of the system. If I take an example about cycling, for example, if your ankle is not moving, you are going to ask to the knee or to the hip or sometimes to the lower back to do the job of the ankle. And at the end, you could have pain in the lower back, but the biggest issue and the root cause of the issue will be the ankle. And Andrew Taylor Still was trying to understand how everything is working together, and the work of the osteopath is to try to find the root cause of the issue. I'm sure when you see other athletes running, or when you use your bicycle or do some exercise, sometimes you can feel some tightness or some pain in some area of the body, and you don't know exactly why. And often it's because one part of the body is doing the job for the other one. I was giving the example of the cycling, but you can see that in running or in swimming. For example, if your upper back is too tight, you are going to have less rotation in your shoulder, and at the same time, all the system who control the blood flow of the arm is come from the upper back. And if the upper back is not mobile, the blood flow in your hands and arm can be not as effective, and you will lose power. And when we spoke about swimming for the Olympic distance, for example, it's 8.5K, I think, something like that, of swimming. Is that or less? I don't remember.
For an Olympic, it's less.
Okay, yeah, the sprint is 750.
Yes, and an Olympic is 1,500.
It's 1,500, okay. And you can imagine then your body needs to move and be able to handle this long swim, and you need to have the more mobility you can in the upper body to help you to swim better. And the goal of the osteopath is we are like investigator, and we try to understand why you could have some pain, or try to prevent too at the same time any injury, because as I said at the beginning, the body is working like a whole, and if you begin to have some issue in one part of the body, it could affect all the body. I have a lot of examples of people suffering from back pain, and the issue is come sometimes from the upper back, neck, shoulder, or sometimes from the knee or the ankle. I often say that the symptom is the visible part of the iceberg, and we really want to know why the patient has pain. For example, if you talk about triathletes, the most common injury is overuse of knee, calf, foot, or ankle. And many athletes can have problem with their lower back too and the shoulders. And in the osteopathy vision, you can imagine that if anything doesn't do the job, you are going to ask to another part of the body to do the job. And with the triathlon, again, between swimming, running, and bicycling, it's very hard on the system. And you need to have everything working together to be sure that you will not have any injury during the race or before the race when you train. I'm going to try to explain a little bit what we do during an osteopathy session. First things, we always ask a complete medical history to try to understand the history of the patient, try to understand if he has any injury before, see the surgery, see the medication too. He gives us some information about his health. And after our work is really to understand why the patient has the pain. And for example, I'm going to give you this history of a patient. He had a sciatica pain, lower back with pain going down in the leg, and the lower back was good, hip no big issue, the knee was good too, and 2 years ago he had a bad ankle injury, and sometimes you just sprain your ankle, but let that away and you can go back to walk and everything is fine. And his ankle was not moving correctly, and you can do everything you want on the lower back and the sciatica pain, but if the ankle is not working, is going to ask to the lower back to do the job. And my session was working on the ankle, knee, and lower back to be sure that everything is working together. And after only 3 sessions, the patient was way better and didn't need to see us again. And that's the more important in osteopathy, is to try to understand why the patient has pain. The goal we have with osteopathy and when we work with athletes is 2 goals. We can see patient before anything happen. I have some patient in the group of the triathlete group that I see in a regular basis to just help them to stay healthy and avoid an injury. I have other than we can't prevent everything, and sometimes you can have an injury, and we work to try to help them to recover faster. And we work on the joint, we work on the fascia, we work on the visceral area too, because there is a lot of, we work on the blood flow of the system to help all the blood flow to go well in all the body. And we use a lot the anatomy and the physiology because, like I said at the beginning, the system will control the blood flow in the upper in the arms, come from T1 to T8, and we need to be sure that everything is moving correctly in this area to be sure that all the system is working well. I often say that a tight spot needs to be addressed because if your elbow, for example, doesn't move correctly, you are going to ask to the wrist or to the shoulder to do the job. And we really look at the athlete as a wall and the body as a wall to be sure that everything is moving. About us, to be fast, we have 2 osteopaths. Hicham Boulamani is come from France, came here since the beginning of the year. He has 15 years of experience. He follow the Cofidis team on the French, Le Tour de France. I don't know, French tour. And he followed the tennis team in Morocco, one of the top national. And he followed the judo team in Morocco. He has a lot of experience with athletes, and is very good in his job. And me, I'm Sylvain Mancuso. I'm here since 10 years. I follow a lot of athletes, rugby and hockey here. I'm working with the Moncton Wildcats for avoiding concussion. That's another part of the work we do. And now I'm going to talk about our service. We have few services. We have the osteopathy session with the evaluation, the treatment, but often the treatment is between 1 hour and 30 minutes. The first session is 1 hour and the session after is 30 minutes. But if you look at the week, the session is only 2% of the week, and we give exercise and a follow-up to help the patient to heal and not be just leave after the session. It's very important to have a follow-up. After, we offer other services like a full physical assessment. We check the balance, the coordination. We check how the eyes is working. That's more on the side of avoiding concussion, but it's a cognitive training system to help to analyze the information faster and be more aware about your environment. I know that in cycling sometimes can be tricky with people doesn't see you, and it's very important to see your environment, and we have special system to help the brain to be faster and can analyze better. And thanks for your time, and if you have any question, I'm here to answer.
Merci, Sylvain.
De rien. Any question? No?
No, not for me. I've always heard about osteopath. I just never knew what it fully entails. So it's great to get this overview. And I can share, if possible, I can share the recording on the Southeast Storm Facebook group afterwards.
Yeah.
People can see.
I will register that and send you the link directly to you.
That'd be great.
I will share a link for you to have because normally the first session is 150.
Okay.
And the follow-up is 100, but for the group, we will give a rebate, and the first session will be 100 to just be a part of helping athletes to be safer and have less risk of injury.
That's great.
I will send you a small letter at the same time, and the athlete can book online directly.
That's awesome. Thank you so much for that. It's greatly appreciated.
Normal. If we can help.
No, merci beaucoup.